I'm joined by Jeff Flaks, President and CEO of Hartford HealthCare. Thank you for being with us again.
Hey, Kara, thank you.
Pivotal time as the state prepares to reopen and get back to some sense of normal. You have a different approach as far as what this is going to look like, and I know you're even helping companies right now figure out what that's going to look like.
We are. We're working with the governor, we're working with the state, and more recently, we're now serving in a number of instances where we've put some of our physicians in as chief medical officers, working with large companies, helping guide them, helping them shape their policy, and helping them make good science-based decisions on how to restart their workforce and really bring them back to their physical environments. So I think it's an important step forward, and we're delighted to be working so closely with our corporate community.
What has to happen for people to feel safe? What should happen?
Well, first of all, testing is absolutely critical. Screening is important. So having the right provisions in place, the right mechanisms to ensure that there's access for all staff members returning to work. But in addition, our team is looking at the cleanliness of the environments, the hygienic aspects of the different environments, the structure of the physical environments. So our team is advising at all different levels around infection control, different procedures that should be put in place. And it's important to do, and I applaud these different companies for ensuring the safety of their organization and making sure the right things are done.
Do you think all workers need to be tested to go back?
You know, it's a debate, and right now we're all driving access. The Restart Connecticut Task Force is improving access to testing dramatically. We're doing so much testing today, well beyond what we've ever done before. We have 10 test centers set up throughout Connecticut. So for people who are symptomatic, absolutely testing needs to be in place. But today we're testing many more people who are asymptomatic, and we're testing people without any physician notes. There's no barriers to getting access to testing.
And what about bringing people back to the doctor? I know some people have been afraid and have delayed care.
You know, it's a really important issue, Karen. I'm so pleased that we've made great progress over the last week to 10 days. We're seeing in a number of our physician offices that we're putting plexiglass in place to protect exposure between our staff and the people who are coming to get care and services from us. We're using technology where people can wait in their cars and are getting texted on when they're ready and when they can enter the room. So we've eliminated interactions in that regard. We've restructured our furniture placements. We've put screening in place, temperature taking. Certainly before anybody gets surgeries in any of our surgery centers, they're getting tested, as are our staff. So there's been so many preparations put in place that are important to do. So we've made real progress in this space.
The bottom line, you want people not to be afraid. They need to get in to see their doctors and keep up with their care.
It's really important, Kara. I mean, people can get sick. People cannot get screening. We have to have this care in place for our community. It's the right thing to do. It's the necessary thing to do. And I'm really proud of the fact that we and all systems around the state are quickly advancing to ensure we have access to care.
Thank you, Jeff Flaks, for that important information. And we'll see what it's going to look like next week.
Thank you, Kara.
And before I let you go, wait. Can Jeff still hear me? I have to ask him. Okay, there we go. Perfect. Yep. All right. So I know you're involved in everything, and you're also a parent. What do you see school looking like in 3 months from now, or when we're able to reopen in the fall? What has to happen to keep kids safe?
My gosh, I'll tell you, as a parent, and I have a graduating senior in high school with plans to go to college, you know, first of all, my heart goes out for these families. People are missing graduations. These kids are missing their proms, their senior year. They now have the uncertainty about when and how they could advance to college or the workplace and under what circumstance. So these are really difficult decisions. They need to be made very carefully and very thoughtfully. And we're working closely advising Connecticut's colleges and universities on these very matters. But decisions around screening, around testing, around surveillance, and around tracing become really important. So, you know, I think there's uncertainty around this issue, Kara, but I am confident, based on what I see from our colleges and universities, they're making the decision extremely carefully with science, with data, and with all of the right sensitivities around protecting the community as they make these decisions.
What about K through 12? That's the story that we're specifically trying to work on, of what school will look like in 3 months from now or even 3 years from now. When you think of K through 12 and you're helping advise the state, what do you see? Do children need to be temperature checked? And how do they keep themselves away from each other?
You know, it's a really significant area of debate today in how we can protect people in K through 12, you know, how we can ensure a safe environment. And I do believe the issues around screening are going to be very critical. And temperature taking, symptom reporting, and those types of things become essential. So we're going to have to see how this plays out. We're going to have to continue to watch the curve. We have to watch prevalence in our community. We have to watch those trend lines very carefully. So this is going to be a debate. I wish I had a more specific and more clear answer, but it's a tough decision that will have to get made. And I'm happy to say, I think, though, when it will get made, we're going to have more data. We'll have more information at that point in time with you know, the prevalence of COVID-19 within our community, as well as effectiveness of medications that are in place, and the impact of large screening that is now available and accessible without any barriers.
So I'm going to put you in the crystal ball situation, but not so much of a crystal ball because you have so much knowledge as a healthcare expert and as a parent. What do you see school looking like in the fall? Is it all online? Is there a blend? What would make you feel safe to send your young children back?
You know, first, I hope that children are able to go back to school. You know, you know, I come from my parents were public school teachers in Connecticut for a combined 80 years. My sister's a public school teacher in Connecticut. I have enormous respect for teachers, for educators, for the role of public schools in our state. And I feel like if we have to move online, we do it out of a protection and because it's absolutely necessary. And if that's the case and we have to make a sacrifice, then that's what we should do. But I think if we're able to go back, if the data shows us, if the science shows us, if our progression is far enough along, there's nothing that could replace the learning experience for kids being in a classroom, being with their educators, and going through that socialization. So I hope with my heart that we're going to return kids to the classroom, but I recognize if the science doesn't suggest it's possible, then having the precautions for online learning and the like becomes what's necessary.
What would be the benchmark if you get to say, we have to see this before we can all go back? What's the benchmark?
Yeah, so I don't know the benchmark today. I think what we're going to look at, you know, I don't have the benchmark with the level of specificity that can answer that question. But what I would say is that we're going to look at the curve, and we're going to have to see the prevalence of COVID-19 within the community, the rate of infection. We're going to have to see the rate of people who are testing positive. We're going to have to see where clusters occur and under what circumstance. And then we're also going to have to be paying close attention to advances with new medications that are emerging, the combinations of medications that are being applied together, and then ultimately the real answer, progress as it relates to a vaccine. So there's a lot of different considerations that have to get put forth to make this type of decision.
And lastly, the kids are starting to get sick, and their parents are very worried about these reports of COVID-related illnesses. What is your latest take on what we're seeing? Because now there are some kids in Connecticut who seem to be suffering with the same thing we saw in New York.
Yeah, the early indications, again, these are still relatively, thank God, rare occurrences. But again, we urge people to reach out to their providers, reach out to their pediatricians. The children's hospitals, their emergency departments remain open and are standing ready. We have great expertise, great resources in our community. And when there's a concern, when there's a sensitivity, we need to make sure that people are accessing the experts to get care and attention at the earliest possibility.
See what happens with all that. Thank you for your extra time, and thank you for giving the insight for the future stories. We appreciate your time.
Thank you, Kara. No, like you with your children, and I have a kid in high school and a kid going off to college.
Yeah.
I fully appreciate what this means, and it's a brutal process for us all to consider. And
people want answers, but I guess we just, you know, we don't really know, which is kind of why we're doing the story of what do we think it's going to look like, or what could it look like. I mean, the plans that I'm hearing talked about are definitely not normal of all showing up in a bus. You know, it's kind of like I saw in Denmark, they're going to school in a soccer stadium so they can spread the kids out.
It's going to be different. And look, your kids with your dance recitals, right?
Oh, yeah,
and
no,
all
that's
that,
not
happening. That's not happening anytime soon.
My son is probably doing Zoom basketball with your son because it's in that same swarm program.
Yes, which is a good thing to do, by the way.
Yeah.
That's a good thing.
That's a good thing. Not quite the same. Anyway, we'll see what happens, but we appreciate your extra time. Thank you, Jeff. Stay safe. Be well.
All right. Thank you. Yep, you too. Thanks, Kara.
Bye.